Okay, so hi everybody, I'm Nicole, and we are going to be talking about chronic inflammation and lifestyle, focusing on nutrition and related factors. So this, actually, you know what, I think when I did that share, let me redo this really quickly, guys, just to make sure I have the right thing up here. Give me 1 second. I'm gonna go back in and try this again. This should do it. All right, so let's try this again. So we are going to talk about chronic inflammation and lifestyle, specifically nutrition and related factors. So just as a reminder, this is the second part of a 3-part series on chronic inflammation and lifestyle. So a couple of weeks ago, we focused on rethinking perspectives of health and healthcare. Today, again, we're going to focus on nutrition and related factors, and those related factors are going to be weight and obesity. And then in a couple of weeks, we'll do part 3, which is going to focus on stress, sleep, and related factors. And those related factors are going to focus on exercise. So just a quick overview of what we're going to cover today. We're going to do another quick review of chronic inflammation as a contributor to chronic disease. We're going to talk about the influence of nutrition, lifestyle, and weight on inflammation and resulting chronic disease. And then we're going to revisit that question that we addressed last time. And that is, does traditional healthcare adequately appreciate and integrate lifestyle as a means of treating and preventing disease and improving quality of life? And if not, should we consider shifting to more thoroughly integrating lifestyle medicine into our existing practice? And this just isn't for physicians, this is for, mental health workers, social workers, counselors, so on and so forth. Okay, since we likely have people today that weren't present for the first part, we're going to do a little bit of review on some things just so we're all up to speed. So let's quickly revisit chronic diseases. So chronic diseases cause the most death and disability worldwide, and we typically associate chronic diseases with like aging-related diseases, cancers, Alzheimer's, diabetes, so on and so forth. But it's not just an older population issue. If you remember from last time, we said that 6 out of 10 people in the United States has at least one chronic degenerative disease, a non-communicable disease. Well, as you age, that increases, but we also want to be aware that, this affects younger folks too. So Watson and colleagues this was a pretty large sample, by the way. They looked at US adults aged 18 to 34, and over 53% of that sample had at least one chronic disease, one chronic condition. And the most prevalent conditions were these in this order: obesity, depression, and high blood pressure. And within those that had at least one chronic condition, they also were more likely to report binge drinking, smoking, and/or physical inactivity. So those lifestyle factors. It is well documented that many chronic diseases are largely preventable through lifestyle interventions. The American College of Lifestyle Medicine, if you remember from last time, reports that over 80% of healthcare spending is tied directly to the treatment of chronic conditions that are rooted in poor lifestyle. Many behaviors and lifestyle factors that contribute to chronic diseases have this common denominator, which is chronic inflammation. And, we talked briefly last time about acute inflammation versus chronic. Acute is the immune system response to an injury or some sort of invader, bacteria, pathogen, right? It's typically, recognized by that redness, heat, swelling, pain, stiffness, right? So the immune system, the inflammatory response goes and takes care of business, and then it downregulates, right? So it's good, it's adaptive. But then we have chronic inflammation, and this is more of a systemic, low-grade inflammation that's chronic. It sort of doesn't serve a purpose. And when we have this, we kind of related it to a flamethrower last time. When we have this like ongoing systemic low-grade inflammation, it really starts to cause problems in the body. It's related to almost every chronic degenerative disease in the body. Researchers have referred to this systemic low-grade inflammation as the common soil of disease. Now, there are clearly a lot of other factors that contribute to developing chronic diseases, but this one just seems to be there all the time. So again, numerous references discuss the link between inflammation and just about every disease, from Alzheimer's to cancer to diabetes to arthritis, you name it. So what were some of those contributing factors to inflammation? We said genetics, environment, aging, childhood stress, and trauma. These are things we really can't control, right? But we also said there are some other contributing factors that maybe are a little more within our control. Drinking, smoking, our personality, especially if we're really high on neuroticism, not dealing with stress in healthy ways, poor sleep, being inactive, consuming a typical Western diet that's full of refined, processed, manufactured foods, having our gut be in a state of dysbiosis, which is largely but not fully related to the food. Mood, if you remember, we talked last time that depression is linked to inflammation. Various social factors and excess body fat on top of other things all contribute to this chronic inflammation. Okay, so we left off with that excess body fat. So here's where we're getting into some new stuff. So let's focus on weight, obesity, and inflammation for a little bit. It's well documented that excess adipose upregulates inflammation. Again, pretty well documented. So, excess adipose produces these pro-inflammatory cytokines that just signal out for more inflammation in the body, and it just creates this constant sort of systemic inflammation. It's even been referred to as meta-inflammation. That's more sort of inflammation due to these metabolic factors. We know that obesity and metabolic related diseases like diabetes increase the risk for mortality by increasing the aggravation of this inflammatory storm or this cytokine storm. We also know that systemic inflammation increases insulin resistance, type 2 diabetes, cardiovascular disease. We also know that inflammation makes it easier for a person to gain weight and more difficult for them to lose weight, which we need to keep in mind if we are, have patients and clients that we're helping, through lifestyle change and weight management. So given the role of inflammation in obesity, Wu and Ballantine suggested targeting inflammation as an additional therapy for obesity-linked diseases on top of, the interventions that are already in place. So just a little bit about obesity and metabolic health. So obesity is one of the primary factors in developing metabolic syndrome. And metabolic syndrome is a collection of factors that increase the risk of somebody developing a stroke or having a stroke, developing heart disease, diabetes. Approximately 1 in 5 Americans meet the criteria or the risk factors for metabolic syndrome. So what are those factors? Well, one is waist circumference. Really, it's kind of getting at belly fat. So a waistline of 40 inches or more for men and 35 inches or more for women would be a risk factor for metabolic disease or metabolic syndrome. High blood pressure is another one. High triglycerides, cholesterol, and blood glucose are the others. If you have 3 or more of those risk factors, that's consistent with metabolic syndrome. So then it puts the person at much higher risk for these particular conditions. A little bit more about metabolic health. There's an interesting study in 2019. They looked at 8,700 participants, and they found that only 12% were considered metabolically healthy. So the other thing to know about this is they excluded people that were on medications for any of those metabolic risk factors, because if you're on the medications, you weren't, metabolically healthy. So only 12% were considered metabolically healthy. They didn't meet any of those risk factors. So that means 88%, are metabolically unhealthy, meeting at least one of those risk factors. And they found that people that were dealing with overweight and obesity had a much higher percentage of being metabolically unhealthy. But we do need to say, too, that even those that were in the ideal weight range, it didn't guarantee that they had optimal metabolic health. So they might have been in, an ideal weight range, but some still had high blood pressure, triglycerides, things of that nature. So, weight doesn't necessarily equate to everything in terms of metabolic health. So some statistics. The CDC reports that obesity rates have tripled worldwide since 1975. And we can speculate on that maybe in the chat afterwards. Also, over 70% of the United States is overweight and obese combined. And actually, the statistic is closer to around 73%. By 2030, Ward and colleagues projected the following: that 1 out of every 2 adults will have the disease of obesity. Obesity will be above 50% in 29 states. And severe obesity, so a BMI of 35 and above, will be above 25% in 25 states. And the authors went on to talk about how perhaps even more, problematic or disturbing is that severe obesity will be the most common body mass index category for women, Black non-Hispanic adults, and low-income adults by 2030. So this kind of even, gets into, as providers, not just our interventions, but sort of what are those social determinants of health that we need to consider as well. And the authors made a great point about addressing weight stigma and the implications of weight stigma. So again, maybe something we can chat about at the end here is, to what degree does the weight stigma impact somebody who's trying to deal with their health and their weight? And maybe more importantly, does weight stigma and bias exist in healthcare from healthcare providers? Do you see it? Do you not? And are there more sort of covert ways that weight bias is sort of infiltrated into healthcare? Maybe that's something we can talk about if we have time. I want to quickly touch on obesity and cancer. There are so many comorbidities with obesity. We could kind of take our pick. I wanted to address cancer because cancer is the second leading cause of death in the United States. So according to the American Cancer Society, overweight and obesity is clearly linked to an increased risk of at least 12 particular cancers. Here they are. The American Cancer Society also says they could be linked to more, but these are the biggest links here. Some factors associated with obesity. Okay, I think this would be a slide to spend an hour on, but it's a short presentation, so I'm going to fly through this. But this is important stuff. So obviously, a factor associated with obesity is calories in, calories out. Of course, we hear that frequently. But I guess I just want to caution that we need to have a bigger perspective. If we only focus on calories in, calories out, we're not going to do our patients and clients a service in helping them with their health and weight loss if that is what their goal is, because there are so many other factors associated with obesity: social and cultural issues, sedentary lifestyle, mood, stress, poor sleep, socioeconomic status and social determinants of health, medications the person might be taking, or medical conditions, hypothyroidism, among other things, hormone disruption, is obviously a huge factor associated with obesity. And I think we know a decent amount about insulin resistance, but maybe not as much about leptin resistance and how the fat cells in the body will release all of this leptin, which is good because it's a hormone that basically says, hey, you're energy full, you're satiated, you don't need to eat anymore. But if that leptin keeps getting pumped out, the more fat we have, the more leptin that gets produced, and then we can become leptin resistant. Heavy metals are a huge issue as well that my guess is traditional medicine might not consider as much as specialties like functional medicine. So there's research out there that suggests people that not only are gaining weight, but are having a difficult time losing weight, even though they're doing what they need to be doing. This could be due to heavy metal buildups in the body. Inflammation, genetics, and the gut biome all are largely associated with obesity. The gut biome, when we're in a state of dysbiosis, that has been linked to weight-related issues. Now, I do want to just add this, my opinion only, and we can talk later, that it seems that functional medicine's approach to obesity management is just really solid. They take a complete biopsychosocial history of the person. They try to get to know them. They are trying to figure out what are the root causes of the obesity. Okay, maybe part of it's calories in and calories out, but is the person not sleeping well, and that's contributing to difficulty losing weight as well? Are they dealing with all sorts of socioeconomic and social determinants of health that are making their health and weight loss a challenge? Do we need to test for heavy metals or do we not? What's going on with the gut biome? So they take a more holistic approach rather than just saying, here's your meal plan for the next month, stick with it, right? There's just so much more to this. Okay, so food, diet, and inflammation. All right. Information on what is and isn't healthy is just frustrating. If you go through the literature and websites, you will find on certain topics, when it comes to food and nutrition and inflammation, you will find that one very reputable institution put out something about a particular nutritional factor, and then in the same year, another equally reputable institution put out something totally opposite. And you'll just see this mixed bit of information. And I think what we need to think as providers, if we find that frustrating, what's healthy and what's not in food, how are our patients and clients dealing with this mixed information? And especially when we think what gets put out on Facebook and all this other stuff, maybe they have good intent to make changes and they want to, but they've got wrong misinformation. So we're going to come back to this one in a second. Let's talk about pro-inflammatory food. All right, so the typical westernized diet, pro-inflammatory. The typical westernized diet is just highly processed food, high in sugar, low in fiber. This National Health and Nutrition Examination Survey found that 60% of the calories consumed in Western cultures comes from ultra-processed foods. And when we say ultra-processed, we mean that it was altered in numerous ways. So not just like the food was picked and gathered and frozen, because that could be considered processed, but the food was actually changed, right? Fiber was removed, additives and chemicals were added, and to a significant degree. If anybody has followed or read anything written by Dr. Mark Hyman from the Cleveland Clinic, he talks about how food is so ultra processed and we're so used to eating this ultra processed food. For many of us, we're really not eating food at all. We're eating food-like substances. So, there's that to consider. So another pro-inflammatory food that this is not argued in the literature. I mean, everybody's pretty on board about sugar. Just pro-inflammatory, destroys the gut biome. We want to consider sugar across the board, but also the sugar we get from liquid sources like soda and sweetened drinks. So for instance, one 20-ounce bottle of soda has 65 grams of sugar in it. So that's 16.5 teaspoons. And if you just really sit and think about this, because, people will grab their, go to the vending machine, get their bottle of Coke or whatever. And if you think about it, what they're drinking inside, there's 1, 2, 3, 4, 5, 6, 8, 10, 12, 14, 16 teaspoons of sugar. I mean, it's just ridiculous, but we consume this and often at high amounts. Don't be fooled by sports drinks. Lots of sugar in sports drinks as well. And if you're guzzling sports drinks, and of course, if you're not like burning any of it off, well, that's going to be a problem. The sugar creeps up in other foods. If we're not reading labels, we can get a ton of sugar in our system in a day. One ketchup packet or 1 tablespoon of sugar, which is, 1 tablespoon of ketchup isn't that much. Nobody uses 1 packet of ketchup. But in that 1 packet, there's 1 teaspoon of sugar. So a third of it is sugar. Bread and butter pickle chips, not dill, but bread and butter. If you have 6 of those little teeny slices, probably together doesn't even add up to half of a pickle, there's 5 grams of sugar in that, which is a teaspoon. Right? So sugar is really added to nearly all processed foods. And we really just want to think about the impact of all of this excess sugar on our gut microbiome, how it's affecting insulin and insulin resistance. And sugar is so pro-inflammatory. If we're taking in all this sugar, how is this impacting our already, people who already have an inflammatory condition? People with pain, especially arthritis, sugar is definitely something to avoid. The Arthritis Foundation, has no holds barred talking about how people with arthritis really need to avoid sugar. And this also goes for mental health, because again, we know that depression and some other mental health diagnoses are linked to inflammation. And of course, sugar exacerbates that. So we have also just one study here, but this is documented elsewhere, that meat increases intestinal inflammation, and which is not good, because then that leads to the gut permeability, which then leads to the systemic inflammation. Sugar and fats also increase that intestinal permeability and pro-inflammatory cytokine production. Now, I do want to make a point about fat. I think everybody at this time or at this point should know, right, that not all fat is the same. The healthy fats we absolutely need if we're going to be healthy people. But then there are those unhealthy fats that we need to avoid, right? So, certainly the trans fats and other related fats we need to stay away from. So we'll just kind of leave it at that. I think we're on board that not all fat is unhealthy and we need the good healthy fats. So it's pretty well documented too that whole food plant-based diets are associated with lower gastrointestinal specific inflammation. As noted from the American Cancer Society, the International Agency for Research on Cancer concluded the following. So they basically work on this category system for food. And they said that processed meats, so hot dogs, salami, lunch meats, is in group number 1, and group number 1 means that that food is carcinogenic to humans, so it's cancer causing. They also put red meat in group 2A, and group 2A means that that food is probably carcinogenic to humans. And according to this report, it's unknown if there's like any particular safe level of the consumption for either. Now, what about, so that's kind of red meat in general, but what about organic grass-fed, grass-finished meat? Well, there's actually research to suggest that if we're talking about red meat, so cows, that cows who were allowed to eat grass and not fed genetically modified grains, because cows should eat grass, Those cows that ate grass through the end of their life that weren't pumped full of growth hormones, steroids, antibiotics, and whatnot, that meat from that type of source actually is really high in omega-3s, which are super powerhouse anti-inflammatory fats, right? And that sounds great, but the problem is it's much more expensive. Not everybody has access to it. And even if you do, who has the money for that? So now let's talk about the part of the information that's out there that is just frustrating, the mixed perspectives in reporting. Okay, so a big, and you know, you can kind of be determined for your own, on your own, you know, point of view from this. But to me, the omegas, especially the omega-6, is a topic that is very frustrating. So we know that omega-3s and omega-6s are essential. We have to get them, and we have to get them through food. We also know, and nobody's arguing this, that omega-3s are powerhouse anti-inflammatories. But it comes down to the 6s. What are the omega-6s pro-inflammatory or anti-inflammatory? Again, you can have research coming out of a very reputable institution that says they're awful, stay away from them, they're terrible, pro-inflammatory. Again, in the same year, research from another reputable institution can say absolutely not, it's the opposite, they're anti-inflammatory, eat more. All right, so what are we supposed to do with that? Because the research, you know, points in literally two different directions depending on what you're reading. Well, one, we obviously want to read the methodology to see, you know, what's going on there. But the other thing too is to consider the sources of the omega-6s, right? If we're getting the omega-6s, which we need from whole foods, nuts, seeds, whole grains, that's one thing. But if we're getting this influx of omega-6s from refined, processed, manufactured foods, well, that might be something entirely different. Right? There's also this discussion in the literature about the ratio of omega-3s to 6s. So prior to industrialization, prior to us just messing with food and, you know, changing and altering food, it was estimated that people ate omega-3s to 6s on the ratio of 1:1. So for every 1 3, there was 1 6s. Well, more recent research says that on average, that ratio has drastically changed. And for every 1 3 we consume, there's 20 6s. And that ratio becomes even higher for children. There's some estimates that 1 3 to every 50 6s for kids. Okay, so does that matter? And where are all these 6s coming from? Well, it might be from the refined foods. So again, we need to consider the source of the 6s. There's also a lot of mixed perspectives on vegetable oils. Are they healthy or are they pro-inflammatory? Well, again, research is strong on both sides, or the reporting, I should say, is strong on both sides. So maybe, and again, I'm not going to say what you should or shouldn't think. You can consume the literature and then decide, you know, what perspective you want to take. But maybe we need to consider how the oils are processed, the refined oils, and a lot of the vegetable oils are refined. Processing, in other words, getting the oil, you know, out of the vegetable goes through a process that typically involves very high heat, solvents and chemicals like hexane. And, you know, these factors can create damage and really just sort of, you know, oxidize the fat in the oil and make it quite unstable. So does that matter? I mean, that certainly doesn't sound good. Does it matter? Well, again, you can kind of come to your own conclusions. Canola oil, we could go through each of the oils, but this one I've just seen go back and forth and back and forth. It's healthy, it's not healthy, it's inflammatory, it's not. Well, canola oil, you know, contains the monounsaturated fats, so, you know, that's okay, that's good. But it's also heavily refined. It's heated, bleached, chemicals are added, it's deodorized, right, in order to give us the oil. Is that a good thing? You know, again, I'm going to leave it there. What about olive oil? Okay, well, if we're talking extra virgin olive oil, this sounds pretty good, and most people are going to agree. Like, you don't see a lot of that mixed perspective when it comes to extra virgin olive oil. One, because typically, it's not always, but typically extra virgin olive oil is cold pressed. It's not refined or very minimally processed. So it shouldn't become oxidized and rancid. And that's one of the problems with the oils. When it becomes oxidized, it becomes rancid, and then it can become pro-inflammatory. In fact, extra virgin olive oil has been found to be very anti-inflammatory. So the Arthritis Foundation reports that 3.5 tablespoons is reportedly equivalent to 200 milligrams of ibuprofen. So the pharmacists in the room might have a thought on that, but there is that. This does not mean that we should have our clients chugging olive oil, because it's high in calories and whatnot, but as an oil to use, as part of their, dinners and salads and whatnot, it's something to think about. Olive oil, extra virgin olive oil, is also high in these polyphenols and antioxidants, brings a ton of health benefits. We do want to consider how we store olive oil. We typically would prefer to have it in a dark glass bottle. When we're done using it, it should be sealed tightly, and we want to keep that bottle out of the sun or heat. So don't have it in front of your kitchen window where the sun's hitting it, because again, if it's not sealed properly and the air is getting in there and it's heating up, it can become oxidized and become pro-inflammatory. The thing we want to think about too is we need to get the real stuff. So there was a whole thing not too long ago about all this fake olive oil that was out there. Actually, other oils being put into the olive oil. So how do we figure out what's fake and what's real? Well, a lot of people talk about this particular test. You just take a spoonful of it, and if you feel like this tingly, they refer to it as like a peppery sort of sensation or bite in the back of your throat, that indicates more of the real stuff. We've got to consider 2 smoke points for oils. So olive oil you can heat, but you can't get it too high because of the oxidation problem. Avocado oil is another oil that seems to be minimally processed, often cold pressed. So if we're just not sure what oils are healthy and what aren't, the literature seems to be at least consistent that these 2 oils are generally healthy. So is there any other agreement in the literature about what's anti-inflammatory and healthy in terms of food? Well, certainly a whole food diet, so minimally processed, that's plant-based. And this doesn't mean you have to eat nothing but plants, but the more plants, the better. A Mediterranean style diet. I mean, I haven't seen where this was argued anywhere, that, this basically everybody's supporting that this is a healthy way to eat. It's high in olive oil, minimally processed, lots of plants, minimal meats. The protein source is typically fish. The omega-3s, everybody can agree on. Eating the rainbow. We've probably heard of that phrase, right? When it comes to fruits and vegetables, the more array of color that we eat, the better. The array of color is going to boost up our intake of polyphenols and anthocyanins. And the fruits and vegetables that are like that dark purple and red are high in these anthocyanins that can really reduce inflammation, be an antioxidant, and obviously keeping the sugar low. Now, also, there's a good amount of consensus about this whole food plant-based diet reducing cardiometabolic risk and promoting weight loss. Now, the thing to keep in mind is the carb sources from this particular way of eating, or any way of eating. You want to go for the complex, unrefined carbs. So you want to go for the carbs that come from fruit and vegetables versus pastries and breads. And it's very interesting because not that long ago, if you remember that food pyramid everybody was, subscribing to, that was wrong. The very bottom base of that food pyramid said that we should be consuming 6 to 11 servings of basically carbohydrates, but they didn't distinguish between refined and complex carbohydrates. So in that 6 to 11 servings, they included bread, all these refined cereals, pastas, right? So again, when we're thinking of the complex, the healthy carbohydrates, more on the fruit and vegetable side, and whole grains. So what's really the best way of eating to be healthy? Just eat real food. Right? I know that's easier said than done, but try to stay away from the processed food, eat more plants, consider what influences our gut biome and permeability. All right, so what are some other maybe powerful anti-inflammatory foods that seem to be agreed upon in most of the literature? Well, the spice called turmeric seems to have really powerful anti-inflammatory effects. The problem is it's not absorbed well in the body. So some research suggests if you're cooking with it, add a little pepper in the dish, and that will help the absorption process. I will say recently, I did see something, it was one particular study or paper came out saying, you shouldn't add the pepper because it might have harmful effects. I can't remember the name of the study. I remember quickly going through it. Methodology seemed to be an issue, and I haven't heard anything about this since, but again, you can check it out on your own. Bone broth, anti-inflammatory, and has the ability to help to repair the gut. So it can be good for the gut microbiome. Berries, ginger, fish that are, high in omega-3s, very anti-inflammatory. But the thing with fish is it really needs to be wild caught, not farmed fish. So you kind of have to really look at the bag or the package. Green tea, anti-inflammatory. In fact, most teas are, but teas also come with a lot of toxins on them. So you might want to look more for the organic tea. And then dark chocolate with 70 to 75% cacao. Okay, so some recommendations by researchers out there. So we have a set of authors that says clinicians should discuss plant-based whole food diets as an adjunct treatment, especially with people with chronic inflammatory diseases. We have another set of authors that say a societal shift towards whole food, plant-based eating stands to provide significant health benefits and ethical advantages, and the medical profession has a duty to advocate accordingly. Then we got Bode and colleagues, and this group really had a lot to say. I'm just going to condense it here. They said for far too long, patients have experienced chronic illnesses because our healthcare system has not taken a proactive role in promoting healthy eating, active living, and even promoting emotional resilience. They then listed a bunch of barriers to this. Speaking of barriers, training and education in nutrition and other lifestyle factors just could very well be an issue. So there's a 2015 study that looked at the state of nutrition in education in medical schools, US medical schools. So they looked at 133 US medical schools. 71% failed to provide a minimum of 25 hours of nutrition training. And I'm not aware of this, but apparently that's what's recommended. The minimum number of hours recommended is 25. So the doctors in the room might be able to shed some light on what they might know about that. 36% provided less than half of the 25 hours of recommended nutrition training. So like 12 hours and less. So what are the authors' conclusions? They said, basically, we're not properly preparing future physicians for everyday nutritional challenges in clinical practice. They went on to say this, which is pretty powerful. It cannot be a realistic expectation for physicians to effectively address obesity, diabetes, metabolic problems, hospital malnutrition, and many other conditions as long as they are not taught during medical school and residency training how to recognize and treat the nutritional root causes. So this brings us back to our original question. Does traditional healthcare adequately appreciate, and I believe appreciate is important, adequately appreciate and integrate lifestyle as a means of treating and preventing diseases and improving quality of life? And if not, we need to make that shift where we start integrating more of lifestyle medicine into our already existing practice. So very quickly, just to clarify, what is lifestyle medicine? Again, we might have some new people in the group today. So there's the American College of Lifestyle Medicine, which is a professional society for all healthcare workers. But then there's lifestyle medicine, which is actually a medical specialty, and it uses evidence-based therapeutic lifestyle interventions as a modality to treat and prevent chronic conditions in conjunction with a healthcare provider's, already established discipline. They really focus on 6 pillars: nutrition, physical activity, restorative sleep, stress management, avoiding harmful substances, and positive social connections. If you are a physician, you can become board certified in lifestyle medicine. If you are a healthcare provider in a different field, there are certifications for almost all other healthcare providers as well. And I want to again bring up that they support and encourage lifestyle medicine interest groups in medical schools and universities. We can talk more about this in the discussion if you like, but there are student-led organizations, faculty supported, that really get the students and faculty working with lifestyle medicine, just sources, talking to the community about it. It's just a cool thing. I'm going to leave it at that just for time. I'm not going to talk about this. We talked about all of this last time, but there are some initiatives in lifestyle and public health that are out there trying to intersect, medicine and mental health and lifestyle. So, this stuff is in the works. So to end, let's discuss, right? And I will tell you this, I wrote down a lot of the points that our group made from last time, because I think they totally apply to the discussion this time. And I bet they're going to apply to our discussion in the third and final part of this series. How can we incorporate this? Is it even important? What about convenience? Pills are easier for patients. How do we promote lifestyle to our patients if it's not as convenient as pills, right? What about the healthcare culture? Is in any way the healthcare culture getting in the way of sort of advancing some of these lifestyle interventions? And on and on and on. I think another important one is, what about at the societal level and macro level and policy pieces to this lifestyle change and lifestyle intervention? With all of that, I'm going to go ahead and shut it down, and let's just have a discussion with the little bit of time that we have left.